Nagamese-English Khobor, All Nagaland Pharmacy Association, अनपा पोरा हेल्थ एंड फैमिली वेलफेयर डिपार्टमेंट लगा नोटून डायरेक्टिव के लोइकिना बिशी चिंता जनाई दिशे जुंतु सॉप फार्मेसी ते रजिस्टर्ड फार्मासिस्ट थकीबो लगिया एक दम जरूरी कोरी किना आशे 20th जून 2025 ते कोहिमा ते एकता प्रेस कॉन्फ्रेंस ते अनपा ऑफिशियल्स जनाई दिशे की तैखन फार्मेसी एक्ट के पूरा सपोर्ट को रे किंतु नागालैंड लगा ग्राउंड रियलिटी ते एडू पॉलिसी लागू कोरा बिशी डिक्टरी होगो नागालैंड ते एतिया एकता भी फार्मेसी इंस्टीट्यूट नए अरुपुरा स्टेट ते खाली 278 रजिस्टर्ड फार्मासिस्ट आशेई जो ते 1175 फार्मेसी चुली आशेई अरु एटू करोने बिशी मैन पावर शॉर्टेज आशे अनपा चिंता जनाई से कि इनका ते अल्टरनेटिव प्लान ना था कि किना पॉलिसी इंप्लीमेंट कोरी ले स्टेट पुरा ते बीसी फार्मेसी बॉन हो जाबो कैरन कुंबा डिस्ट्रिक्ट ते एक दा भी रजिस्टर्ड फार्मासिस्ट नए अनपा पोरा क्रिटिसाइज कोरी से की गवर्नमेंट हेल्थ सेंटर खान ते नर्सेस खान के 3 महीना दी किना दवाई भी डिबो ले दी आशे किंतु प्राइवेट फार्मेसी खान करोने करा कानून दिया तो सोरकर लगा डबल स्टैंडर्ड आशे अनपा पोरा हेल्थ डिपार्टमेंट कमिश्नर एंड सेक्रेटरी हेल्थ मिनिस्टर अरु चीफ मिनिस्टर के भी रिप्रेजेंटेशन दी से किंतु एटिया तक कुनु पॉजिटिव रिस्पांस पा नई कोई शे एटू ते एसोसिएशन पोरा एटिया निमते एटू पॉलिसी तू रुखाई राखी बो ले सोरकर के रिक्वेस्ट कोरी से अरु प्रदेश ते टेम्परेरी ट्रेनिंग प्रोग्राम इंट्रोड्यूस कोरी बो लगिया अरु फार्मेसी इंस्टीट्यूट खुली बो ले डोरकारी जनाई से जून पोरा पब्लिक हेल्थ टू डेंजर ते ना जाबो अपनी खान एटू सा टाइम ते पहिला बार जुरिया व्यूअर खान के चैनल टू सब्सक्राइब लाइक अरु साथी खान के भी भाग कुरी किना होदाई जानी की ना था की बो ले अनुरोध कुरी आशे
Now, the English news. The All Nagaland Pharmacy Association, ANPA, has raised serious concerns over the enforcement of the State Health Department's directive mandating registered pharmacists in every pharmacy. Addressing a press conference held on 20th June 2025 in Kohima, ANPA officials highlighted that while they fully support the Pharmacy Act, the ground reality in Nagaland makes implementation extremely difficult. The state currently has no pharmacy institute and has only 278 registered pharmacists for over 1,150 pharmacies, creating a huge manpower gap. ANPA warned that enforcing the rule without alternatives will lead to the closure of hundreds of pharmacies across the state as some districts have zero registered pharmacists. They also criticized the double standard stand of the government where it has trained the nurses in state-run health units for just 3 months to give medicines. The officials said ANPA has submitted representations to the Health Department, the Commissioner and Secretary, Health Minister and even the Chief Minister, but is yet to receive a positive response. The association urged the government to delay strict enforcement and to introduce interim training programs and establish pharmacy institutes to ensure public health is not put at risk due to a policy. As you continue to watch the coverage, we request our first-time viewers to subscribe, like and share our channel to always stay informed.
First of all, I'd like to thank God for this time they've given to all of us. Today, we are gathered here with the party of aggrieved All Nagaland Pharmacy Association. Before we begin further, I would like to introduce this my friend to you all. This is on my right, Lima, the General Secretary of the All Nagaland Pharmacy Association. Puluta, President of Kohima District Pharmacy Association. Tolibo, the Treasurer, Kohima Pharmacy Association. Sister Sikosa, the Assistant Gist of Kohima Pharmacy Association. On my left, Hyacinth, the President of the Parent District Pharmacy Association, and Michael, the Secretary of the Parent District. Today, we are here to highlight some of our grievances to the government for what is happening around here in the many part of the social media. Also, I would like to thank the media friends for coming and covering up of this particular time. The reason that we are here is like we have got something to tell to this, even to the government and even to the public, for what is happening here. the issues as they reach us, they have given the show cause notice in the year of 2021. So from 21 onwards, we are getting with these issues still today. We would like to make it very clear to the people of Nagaland that these issues is not only 5 years, 10 years. These issues has started from the time of since the existence of the Nagaland states. So it has gone, these are 40, 50 years issues is there. Now, with this, the 40, 50 years of the issues that we have today, now these are the states is the shortage, the states is facing of this one, and where we have this from all over the 14 district, which is affiliate to our association today. And because of this, the transportation, because of this, the weather, the other district could not turn up. Only this around here could able to be here this morning. As we said earlier, these issues that we would like to let our, the people also to know, something like we are doing for the people of Nagas in general as a whole. We are not doing just for the business, but this is our service that we also been contributing to the society. Our contribute, instead of acknowledging of our contribution, now we are facing this kind of thing. Now many pharmacies across the states have been closed down because of the show cause notice and the cancellation order. In later on, all these details will be, briefing you. As we said earlier, these are some of the things that today we are here. So before we go further, I will give time to my secretary to highlight some of these the things which has been, said and written for all of us today.
Okay, first of all, I'd like to thank the media fraternity for covering this event. Now, in the first place, we want to portray our grievances as well as our, the conclusion that we have come to after going through in-depth study of the matter. So I'll go through the points one by one. So, now we all know that in February 2025, the issue of closure of pharmacies without pharmacists came to the fore and got widespread media coverage and scrutiny. There were many instances where the pharmacy community was demonized. We were even portrayed as running our pharmacies illegally, which is not factual. In fact, we are also a victim of the corrupt system. The general public as well as our media was made to consume only one side of the story. NBA could have, but chose not to react at that point of time. That is during February, March. Instead, we decided to have an in-depth study of the ground reality as well as the implications of the department's action on the overall health sector of our state. Now, I want to stress on this because in the tussle between the department and the pharmacy community, it will be the general public that will suffer. And that is the point I want to stress. Now, at the present point of time, NBA has done a bit. We have called this press conference so as to provide facts and figures and our side of the story for public consumption and cognizance by the Department of Health and Family Welfare as well as the Government of India. Now, I've said that we are also a victim of the corrupt system. Now, why I'm saying this is the point. Now, how the pharmacies are run in Nagaland? How are the pharmacies run in Nagaland? Because it is not a vegetable shop. It's not a vegetable shop, so we cannot just blindly open a pharmacy. There are certain systems we have to follow. Now, the procedure that is in the system that is being followed by the department is our pharmacy licenses are issued by the Health and Family Welfare Department, wherein they provided the name of the registered pharmacist and their registration number. We were asked to pay a certain amount for the license which each licensee has paid. Then the licenses were renewed after every 5 years. Renewal fees are charged from each licensee. This process has continued till the early part of 2024. Now, moi ade kiwa ita bole mon ase. Moi ade license ita thikai dibo. Itu license te apni video bar cover koru mon chale dibi, that will be very good. Yate department ba dia dole SR Chaudhary is a pharmacist, person qualified in charge to look after this pharmacy. His registration number is 334. Now system to kina thakisi bole do we are laymen. One layman ase. Or when jania rakto bole Department of Health and Family Welfare ram moinge edo pharmacy license to gi when one jania luise. So what we did is when application likhina jena department ge we asked for a license, a pharmacy license. When jena edo dise department bar ki korise time bar edo ready kori dise or after a few days all of team bichide avni la license to ready hoisile logule ina hoise acha wana moen jaise jaina moen license utha lenge license la fee do kiman bode ina hoise moen edo ti dise. Now department bra moen ide jani ase de moen ide jani ase. The actual system is when apply gura lenge moen osol dole moen pharmacist la certificate luena jabo lage. Department never asked us for a certificate. Only then nami likhina disido to moen to holise maybe the department assigns someone to look after our pharmacies. To moen to ituka follow guse. Ina ona moen pharmacy to run grid wana hise. That is the reason why I'm saying that our business is not illegal. We have been running our pharmacies legally. Legally run one. The other point I want to stress is, Aunian media general public department is claiming that since 2020 by itulan notice to dia suru usi. Holy Moine pharmacy community land knowledge to the first notification we got was in September of 2021. 2021. Yet I want everyone to think about this. I have a retention certificate in my hand. This is the retention certificate of a certain pharmacy that is provided by the department. Now, itola retention certificate to it was given in 2023, and this license is valid till December of 2028. So department wale 2021, 2020 ba itola pharmacy pon gole pharmacist to mandatory hobo when at time janina hasu bole. Why did they issue it? It retention certificate as there. They issued new pharmacy licenses even in 2024. Now, how is the department functioning? It was a big question that that is the reason why we are saying we are a victim of the system. We are a victim of the system. It does it. The other point I want to stress is Department of Health and Family Welfare started issuing orders to the pharmacies to appoint a registered pharmacist in the later part of 2021. Pharmacists in Nagaland took cognizance of the order and hence pharmacy union was formed in each district and efforts were made to appoint registered pharmacists, and at the same time representations were submitted to the department citing the difficulties faced by the pharmacists due to the shortage of qualified pharmacists and appealing for extension of time. When the 2 months, 3 months enough to national extension to elect. Of course, that part we acknowledge. But when the department started implementing the policy with earnestness, the need for a state-level association was felt necessary, and hence, all Nagaland Pharmacy Association was formed on the 13th of March 2025. Yadi ekta when clarify rule munjado, ito la issue nula naktuile Nagaland de pharmacists kan affairs kan doile Nagaland Medical Dealers Association bra. So say this. But when this issue came to the fore, when NMDA give one approach to it, but Tanla initiative to we were not satisfied. They didn't even call for a single consultative meeting of the other districts. So what happened was that the issue was going on. The closure of pharmacy was at hand. So what we decided was that we have to stand on our own. Itulah understanding bra on the initiative of Kohima Pharmacy Union, when state kangi mati luise inarona Nagaland All Nagaland Pharmacy Association do 13 March 2025 the form policy. Still now, Timabo, Sumagadima, Aro, Newland Willie, NMDA Rukainasi. They are unable to join us. But we want to send this message to the NMDA that we have no differences with NMDA. Our goal is the same. So that is the reason why we appeal to NMDA that it will be much better for all the pharmacy community if we can work together. When you do message we portray now NMDA form grab when NMDA come grab NMDA as a first step approached the department and submitted a representation to the principal director and the controlling and licensing authority, praying for a reasonable extension of time. But the answer we got was negative. Therefore, we decided to approach both the department as well as the government. We therefore submitted another representation to the Commissioner and Secretary, Health and Family Welfare, but again, the response was negative. Then, we have submitted a representation to our Honorable Chief Minister of Nagaland, and the response is still awaited. We have also approached our Honorable Minister of Health and Family Welfare, but we were denied appointment. We therefore sent a representation to the stenographer to our Honorable Minister. When Pabishe Health and Family Welfare Minister to since he represents the whole Nagaland, we thought that he will be the right person to approach. Ito ang man approach ko ulit try buje. He is reluctant to give us appointment. Even his senior BS is reluctant to meet us. Maybe they are too occupied with some other works. We do not know. But I think we expect our concerned minister to at least meet us and hear our grievances, whatever be the outcome. We have also been trying to meet our Chief Secretary, but is yet to get an appointment. Chief Secretary, you want to see what we try to get appointment na. Now, at the same time, when ito kure no na representation kati diyan no na on an individual capacity as well as organizational capacity, when pharmacists to appoint really try to get. When actually yung moto kure na appoint really try to get. But the fact is, Nagaland does not have pharmacists. Nagaland does not have pharmacists. I will come to that point later on in more detail. Polibi one achila TV one successfully employing one achila TV. We are putting in our efforts. Now the department at some point of time has claimed that we never took cognizance of their notice. No, we have taken it very seriously. That is the reason why organizations were formed. And we are putting in efforts. Polibi subji na thaya na mansun na bagay na mansulode bat khabi bole ito to bishi problem damor one is now is one problem do. We don't have qualified pharmacists in our state. Enough pinogo. We don't have qualified pharmacists in our state. So itulah situation when they are forcing us to employ a registered pharmacist at any cost. Now, how do we go about? Are we ready one point stress if the department can, think about the matter seriously, and since we are also stakeholders, if they can invite us, maybe together we can come up with a workable solution. That is also an appeal to the Department of Health and Family Welfare. Now, The other point I want to stress upon is ANPA fully understands the requirements mandated by law and we are willing to abide by it. One pharmacist narakibo guanoide. Now only we are coming to know that mandatory as a pharmacist to rakibo lage. Well, we want to employ the pharmacists, but give us some solutions. That is what we are asking. That is what we are asking the department. Now, this is also very important. See, Nagaland being the only state in India without a pharmacy institute is faced with acute shortage of qualified pharmacists. India being a developed country with inadequate manpower to mitigate the shortfall of qualified pharmacists has even introduced diploma and pharmacy courses but still cannot produce enough pharmacists. Moreover, no state in India has thus far successfully implemented this policy. In fact, according to our controlling and licensing authority, Nagaland is the first state trying to implement this policy. Now, yadi ekta puta ase. Nagaland even union territories to be sought the pharmacy institute ase. Nagaland is the only state in India which doesn't have even a single pharmacy institute. And even the Nagaland government is unable to send adequate number of students to study pharmacy courses on government quota. Now, what is their plan of action? How do they mitigate the problem? Because they know very well that there's a problem. But we don't see any efforts on the part of the department as well as the government of Nagaland to mitigate this problem. Sabi, advanced countries can, European countries can do diploma in pharmacy no loide. Time a minimum qualification to a bachelor's in pharmacy. Only India did to manpower neither. India is still a developing country. We don't have enough manpower. Ito ba dan pharmacy diploma in pharmacy course be introduced for this year. But still shortfall to really be other states, actually Google does so pachanilo. Alak states can decide Andhra Pradesh, Maharashtra and Lani 50-60 institutes. There are 50-60 institutes in those states. How many pharmacies are they producing each year? Nagaland is the only state without a pharmacy institute. To government plan of action to be clear. Our still other states can one pharmacy institute that it to love policy to implement rule na parnas. No state has successfully implemented this policy. In fact, in some states the matter has been litigated. It is under litigation. So, Nagaland ito lang condition our controlling and licensing authority has proudly told us that Nagaland is the first state to try to implement this policy. Are we in a position to implement this policy? I think it's a big question that the public deserves an answer. Public deserves an answer to this. Now, if you look at the ground reality based on various data, the ratio of pharmacists in Nagaland to the number of pharmacists in Nagaland to the number of registered pharmacists is quite disproportionate. As per the data provided by the department and published by the Nagaland Post on the 14th of February 2025, there are 1,157 pharmacists in Nagaland. Ito pharmacy kuli na thahan niya side. License lui na pharmacy no kulian do kiman 1,000 ho ito do when kuha na paro. Ito do data kali possible do. I don't think it will be a small number. Whereas there are only 278 registered pharmacists according to the Department of Health and Family Welfare. Now, let's work it out. Time by Nagaland Post kuha isap dito, or Nagaland Post publish kuha isap dito, 1,157 operational pharmacies in Nagaland. Whereas time by data provide for 278 registered pharmacies in Nagaland. Out of 278, 252 the government employees are there. So government employees cannot run a pharmacy. So let's put them out of the picture. Now, how much are we left? We have 26 pharmacies left in Nagaland to look after 1,157 pharmacies. Ito point, ito ita ase. When grievances fee ito ase. The other point, I think this is very important. Impact of the policy of the public health sector. ANBA, after thorough analysis of the ground realities of the view that if the government is to implement this policy in its entirety, will put the public health sector in complete disarray. Here are some data in support of our views and for the consumption of both the general public as well as the department. Even in Kohima, the state capital, some colonies like AG, Merilita, Leary, etc. will be left without a single pharmacy. Habi sa ito point Kohima la wes de. Our AG colony do largest colony in Kohima. Government ba pharmacy sok to shutdown ko disi bali do. Leary dito ekta pharmacy bi nabajibo, Merilita di ekta pharmacy bi nabajibo, AG colony di ekta pharmacy bi nabajibo. To itya stop ekta 18 rupees for kiniwale colony la pharmacy di kini thado. The nearest place they can go is Pier Hill. Just think of the inconveniences caused to the public. Our rati bimar ekta hosi kiba ekta hosi bole. Even basic medicines bi dibo na parole. Even a simple headache, probably manu muri jere. Holy suddenly rati di bimar hosi bole do, to kut par lobo. Morning no hada disorder morning bra muji morning tak morai di de wena rukhabo na ye. Ito last situation ekta de ase. That is about Kohima. Let's look at the data of some districts. Melori, Shamadur, Pe. Melori di presently 6 pharmacies are there. Pharmacy choita ase. Tadi ekta bhi registered pharmacist nai. Shamadur de 4ta pharmacy ase. Ekta bhi registered pharmacist nai. Pek district de 34 pharmacies ase. Tadi 2ta in service pharmacies ase. So in service pharmacies kan to tayo na license to cancel korbo lage. So just think about this. Melori, Shamadur, Pek kan to ile whole district without a single pharmacy run korbo. Public la health to kila position ekta de rakhi dibo. To ito district headquarter ang ase. Now think about the subdivisions and rural areas. There will be complete chaos. There will be complete chaos. Now we want to ask the department, the wider question is the department in a position to fill the vacuum? Tayo pharmacy so bon ko to tayo na policy to ki ase. We are going to close down all the pharmacies, and in the meantime, we are going to do this so that the public doesn't suffer. Tayo ito la point of action. Ektabi asina ne. Tayo na concrete policy ektabi asina ne. I don't think so. Now, another point we wish to stress upon is that there is no case in Nagaland where a patient's life was either lost or put in jeopardy because of wrong medications administered by any pharmacy. In fact, everyone must refresh our memory and think of the services provided by the pharmacists during the recent pandemic, that is COVID-19 pandemic, when the department or the government was in no position to even provide basic medicines to the general public. Now, at that point of time, the burden and responsibility was borne by the same pharmacies that the government and the department is trying to shut down. Ito the point, so public, general public POV, kun bravi noy ko na parbo. COVID-19 to kila situation na yun. Pharmacy and thake na yung likod yung jawa tayo. Was the government even in a position to provide even basic medicines? No. What if another pandemic comes? Transition to smooth whole transition has to be smooth. There must be a solution. There must be a solution. Of course, we are not saying that the policy is bad. Nagaland has to move forward. Nagaland has to move forward. So, of course, changes has to be brought about. But These kind of drastic decisions will put a huge vacuum in the public health sector. That is what we are observing. Now, the other point is, health is a state subject as per the constitutional provisions, meaning any state can frame health policies that is relevant and applicable to their state. Then the question is the government of Nagaland and the Department of Health and Family Welfare Department equipped adequately to step in and fill the void? Now, I want to ask the department, do we even have a Nagaland-specific health policy? If there is, make it known to the public. But I think the answer is a big no. Our government is unable even to appoint qualified pharmacists in all the government-run health units. Now I want to provide some data here. Public health units, government-run public health units, TV department pharmacists, sufficient pharmacists appoint guru na parnas de. Mon district ek pasawo, sub district na sawo lim way kunwa district la data video. Mon district is Shangyo, Oting, Wanjing, Angbang, Mokong, Yonggao, TDC Mon. Itu ang the government registered pharmacists appoint group na parnas de. Pek district e wo. Semo Pek, Chief Medical Officer Pek TBA, only 2 pharmacists are there, whereas the sanctioned post is 3. Tadi bisa choto, Tetsume, Kuzame, pharmacist 9. Public health units to Kulisi Olivi, pharmacist appoint group 9. Melori di Parsawa, Khobor, Lepori, Baziho, Akiko, Sitzi, Hutzi, pharmacist 9. So if the government, even the government is unable to appoint adequate number of registered pharmacists, timely solution to key diya. So in the meantime, what the government is doing is to solve the problem. What the department does is to impart a 3 months training to the nurses, and now the nurses are dispensing medicines to the patients. Should the same yardstick not be applied to both the pharmacies as well as the government-run public health units? To time na public health units, the pharmacists appoint group na parewa 3 months training course di na nurses can give medicine di wuli diya siguro. They are not registered pharmacists. Should the same yardstick not be followed to both the pharmacies as well as to the public health units? Time dito pharmacist na thagyawa appoint group na pare na sinagi. To targo appoint group na pare ako man kita job po just apne ando kut probably appoint group lagi. Ito itas de. Now, NBA is of the opinion that the department can come up with such programs if they have the will and are concerned about the public health. And certain policy, state-specific policy, in the meantime, when shortage of pharmacists face product to a certain policy implement, let the transition be smooth. Now, in conclusion, NBA is not against the department or the policy in question. But we are of the opinion that Nagaland is not equipped to implement this health policy at the present point of time. We are hopeful that the department would come up with some workable arrangements till such time our state will have pharmacy institutes and sufficient qualified manpower to provide healthcare to the general public unhindered. In the meantime, we appeal to the department as well as the government to allow us to operate our pharmacies till such time the department comes up with a concrete health policy that is relevant to our state and that the public health care is not left in a vacuum. We assure that on our part, all our efforts, both individually and on an organizational capacity shall be made to employ a qualified registered pharmacist. So, when in conclusion, when last day we appeal problem on us, when we try to run, we have done our best, we are trying our best, and we shall put in extra efforts in the days to come. But we want both the general public as well as the Department of Health and Family Welfare as well as the government of Nagaland to look into the matter seriously. And come up with a workable solution for the interim period till such time when we have enough pharmacies to take the mantle. So that the transition will be smooth, the public will not suffer, and everyone, irrespective of whether someone lives in the cities, towns, or rural areas, will get at least basic medical service. That is what we appeal to our department. Now, thank you to our media fraternity for your patient hearing. Now I'll open the time for Q&A.
You have mentioned that the government is unable to appoint qualified pharmacists.
Yeah.
And you have also stated that there is a lack of qualified pharmacists.
Yeah.
So what could be the reason behind it? Is there a lack of interest or some other reasons that we don't have qualified pharmacists?
No, that is the reason why I provided some figures also. See, first thing is our state needs institutes to produce enough pharmacists. Our state needs enough pharmacists. Now, institute থাকিব লাগে তো, institute the pharmacists, qualified pharmacists can do pass out কৰিব লাগে তো. Now, we know, only state the একটা institute pi নাই pharmacist institute. Government at the most they can send is each year state la kota je 5 jun 6 jun ke pharmacy la courses puribule kota ase to. Na. So every year government, let's say that every year government is producing 5-10 pharmacists. Will be at the same time, itia pharmacists thakia to be retired be hoye ase mori ase lo. So the number is not increasing. It was a problem though. Pharmacists 9. We have inadequate qualified registered pharmacists. That is the main problem. It's not that we don't want to employ. We want to employ. We want to save our business. Because this is not just business. Okay, of course, there might be some rotten apples. Rotten apples can be taken with a community. We are not denying that. Only most of us, when we do business run, brother, it is for our sustenance. When it do our family survive present. On top of that, we are also providing service. When it be as there, when this is unlike other business, this is an ethical business. When it do thought pukina one puride. Thousands of families are dislocated. Thousands of families are dislocated.
So I'll just supplement something. There are 1,157 pharmacies in Nagaland.
Yeah.
So according to the data, there are 278 registered pharmacies,
Yeah.
where 252 are government employees.
Yes.
So 26 pharmacies are meaning these 1,157 pharmacies. So what I want to know is, how currently,
Yeah.
how are you operating the pharmacies? Are you providing training to those manning the pharmacies, or how is it?
No.
Just to supplement my friend, like what I want to know is, since you are saying that there are no qualified pharmacies, no, but so how are the pharmacies being run? So without a qualified pharmacies, so how are these being running? So how are they providing the medicines to the people?
Actually, in Asin, when Nagaland, the first place where department by strictly implement ICU law, no pharmacy would have been running without a registered pharmacist. We department by license, ready-made license, Now, of course, we were ignorant of the law. We admit that part. And ignorance is not an excuse. We also accept that. But that was the system. That was the system. Because Nagaland the pharmacist na thagawai and pharmacy license to it, tribunal la busina. Nagaland deliver ekta interview la the controlling and licensing authority deliver busin. Tribunal form grana then base of experiences. 5 years experience, 10 years experience it one year. Then give out the pharmacist certificate. They were appointed as pharmacists, as registered pharmacists. Paramedical Institute TV 2 years course is introduced procedure. In our it's not diploma, okay? Certain policy in our then it will mitigate grow and immediate they produce a huge number of pharmacists through that course. In our Julina is the government dakbabi itu policy. So pharmacy to pharmacists can run globally though out of question. So presently, most of the pharmacies are running without pharmacists. It's either based on experience. Bishiwala do ile ekta pharmacy de buibo. Tadiba experience can go, doctoral knowledge can go. Ina wana self-taught as it. Self-taught as it. That is how our system is running.
I'm asking too many questions, but one more question from
Okay, no problem. Take your time.
You have in your statement clearly stated that the government and the department does not provide any clear-cut solution for this problem. So what is your suggestion for this issue, apart from asking the extension of time?
No, ito na. Inaitase. Like you pointed out, we are asking for extension of time. Now, in the meantime also, we are not just going, when there any representation being made. We sit with them. We try to talk to them. When the time Puchuguna Yedulabi when approach Korea. Now, in the meantime, when the expectation be, let's come up, let's sit together. Let's discuss the matter. Let's discuss the matter in depth. Our ekta solution ekta ani mo try go chalna. Kile mani sabe. Itya Nagaland de 700, 800, 900 pharmacy own policy bolido. Ultimately public is suffer go. Na public is suffer go. Ito ba? Yes, we need to move forward. We need to move forward. Kung sila Nagaland di, bulay na thani siya when bulay na thani siya ito la system di tayo ito noy. We need to move forward. Well, ekta move forward government di, come on, let's sit together. Ekta transition ekta chalna, ekta solution ekta bisarwo chalna. Na, let the transition be smooth. In the meantime, when we pariya research pharmacists to employ go. Na, our department Ravi, come on, do your best. Bring pharmacy institutes. Ek time na duita din ajikali to private institutes kan bi anibo parbo. Anina institute ek time na jalla alag state kan bi pick wana pasta chida ani na. Ina wana produce enough pharmacists so that the transition will be smooth. If and when the government comes with such a policy and if and when the state will have enough pharmacists, we don't need the government to ask us to tell us to close down our shops. We will shut down our shops on our own, voluntarily.
Adding to that, itu pharmacist to shortage while majodi bi ite do ami khan ki communicate kora do bahar bra itu pharmacist kan anya khan to itu bi bom haja si ite do ite bi kunti nai bi nai ini ko ha majodi ite do apni bahar bra bi pura man bi certificate bi ani kine chulibo na parbo to ami khan ko to bra chulibo ami khan itu kane agide sati ko ani sinami khan to gor itu department ke ko bole mon thake to itu time to aro extend korbi na ini ka hoise bole ami khan bi itu time de kini ka hole de parbo itu la bi bisarbo do inigabi na wala mi kambi kinigaw grupo. Ami kan aji tu inigaw jese itu bara aji tu so ai gini inigaw ko thapura sde.
Abnigan Nijorbi ko na Abnigan qualified pharmacist no hai. You are just running the pharmacy on an experimental based experience that you had from sitting with some doctors or maybe in other with some pharmacists. तो होली भी तो इतना अपने का टाइम एक्सटेंशन मांगी था कि ले भी इन्हें you know that pharmacist एक तो pharmacy तो कॉलोनी ते थकिया तो डॉक्टर निजना हो जाए तो in many places no because without prescription भी दवाई दिया खान भी ऐसे दे ना because जाइना बुखान इतु अजी इतु हाजो बोले इन्हें pharmacist तादे pharmacy दे थका मनो हम बराए दवाई तो इतु खाइले बाल हो इन्हें दी दिए तो so that means you are doing it without the actual qualification you are having just out of experience so now you are asking for time extension तो आप निहान भी की solution तादे की करो आप निहान into there because just asking for time extension
Bisari bo ami kan.
बिसारे वो तो नाइ बोले को दे बिसारे वो
Tadi na, tadi mo ita point ita stress ko muna sa. Mo ikan, of course, mo kiba gradually na sa. Mo extension of time mangya sa. It will ita, so that we will hunt further. Na, we will hunt for pharmacists. Decision paya sa de, achieve kalibi action tuition ni pay na. Ina na decision paya sa de, babi. Aru mo department give approach kujo sabi itula problem ase there is shortage of pharmacies why not in the meantime awan chalna eta come up with certain courses na eta course eta kiba eta introduce ko na awnian ina actually we are even willing to pay for that course na we are even willing to pay bear the burden believe transition ko do we are also losing our livelihood. That is also one thing. Of course, that is not the main point we are stressing upon, but one is a solution to Bisharmo Nimide. Ekta course can be introduced really key. One is a department of pharmacist appoint group na pariaba 3 months training course din a nurse can be PhD. Tawai di good yes lo. Now, if the government can come up with such kind of policies, for a certain period of time. We are not asking for 20, 30 years, okay? We are not asking for 10, 20 years. But in a few years, immediate transition to our state will also have enough pharmacists in the meantime. Na, arum one immediately one livelihood as it here. It will have business to na. One livelihood pi as it. To she will when you look time, she will one be. Pharmacist appoint group, parallel group, noisy will one be other business can be transition group na transition period to extend good winner. It took ways in one bottle there.
One question, you're talking about extension of time.
Yeah.
Right. So how do you have a limited period, like 5 years, 10 years? Any time frame set for the extension?
No, we are not demanding for 3 years, 5 years, or 10 years. But we are appealing to the department to give us a reasonable period of time. Reasonable.
So what is that reasonable period of time according to your association?
That is what we are saying.
Until such time, the government is ready with the qualified pharmacists. Because I just want to come in here. Pharmacy amount how you are running with a qualified pharmacy. We also admit that we are running pharmacy with a qualified pharmacies. Only necessity is the matter of invention. The needs of the hour, the needs of the time, compel us to choose this profession. This pharmacy is a noble profession. Not just jump into this profession. Only be looking to expect the needs of the town, the needs of the area, our area. Pharmacy nine, I myself will suffer. So why not we find some solution? Medical field is medical company they come for. I'm just taking an example. For a few years, then I got experience in medical things, then left that company and back home and started pharmacy. So still now I'm running more than 20 years. I'm running pharmacy. So experience to judge. Though I don't have that pharmacist qualified certificate, not a pharmacy holder, certificate holder. Likewise, everyone has their own story, how we are come in this pharmacy profession. Itu need based dia mohon ayunan join guna tadi. Asal tu this pharmacy muna former speaker tadi so bal bal ini details itu baru nanti gua explain. Believe we are not just doing a business here. We are also trying to bring some change and trying to have to serve the people. Pharmacy business itu is something like not like other business. Itu karena amon aru apni kang ni janji there are just compare with other business. Pharmacy business is running with full discipline. Our rules and regulations bishi ase. Today we'll have to maintain the stocks, temperature, guidelines bishi ase. We are observing, we are following, we are obeying all the rules and regulations. Inia guna thakatu itia mohan ki tulaga issue ulai dia tu actually it is not an issue. Yate public here misunderstanding kurase. Olivi amoikan it is not that we are cooperating with the department also. We are trying to cooperate with the department. Olivi itia ki ase department ko ato mohan ke your pharmacy cannot be run without pharmacists, experienced pharmacy and qualified pharmacists. Right. So itia to amohan to golti nai gola koi dise documents saisi everything is perfect. The license were issued by the department only. To aman ko golti nai libi aman itia criminal ni sa lot trick right. To aman la golti ki ase kule to we don't have pharmacists. And we are also trying to bring out to come with the pharmacists and we are money bisari ase. To state among Nagaland state la conditions I sigule ite tani pula number 2 koi dise ground ready tite sai sigule we don't have a pharmacist qualified pharmacist nai thaka to oro thage se 278 dikhai se ite bra bi bisi kunti no bra bi among figure part to paise to ta kan bi maximum to ta kan government employee ase na pura 26 someone paise 26 it be to ta kan master in pharmacist doctor in pharmacist grown ase they will go for another job so pharmacy de boy ko no 7-8 lakhs खर्चा करना किंया pharmacist तो इतना बोल बोले मोनो तो इतो करे तारमी willing भी ना है तो अमाना state अमान बिचारे से ना पाए तो इतो बराती कैसे एदिका होले कोई ना अमान तो शास्त्र इतनी भी अमान convince करना आनी बोले कुछ तारंगा आये बोले मना है भी convince करना आये बोले करने again the department say will not allow from outside तो where do we go एदिका से अब तक कैसे तो pharmacy is not the only way of survival तो अमान बंद कोई तो बोले public to suffer करो तो हमें बंद कर दिया इधर ताई बंद कर दिया वहाँ सब बंद कर से बोले कौन सफर होगा देन दे वहाँ सब पब्लिक सफर करो तो किले बोले इतिहास सभी किन्हीं का उपाय तक करना भी अपने से बोले ग्रुप बने दे मनो डॉक्यूमेंट्स लगे ना फार्मेसिस्ट लगा इधर डिग्री होल्डर kan D farm गोला सर्टिफिकेट तो लगे ना हैंग करना से तो बंद तो लेकिन the person is not going to sit in the pharmacy all the same person is dealing with the medicine only the certificate is hanging in the pharmacy. Itu no, तो itu justify group orang mana, itu noy to, itu bera, moi ko to moi to interest na itu group le, dari na moi noy ko le nai, moi na pare ko le nai, cari dulu, lebih itu jadi na bisari bo pharmacist, bisari na ani bo, tadi hang group bo, itu manu ke ada to pay another 10-15 to 20,000 extra for that documents only, whereas the person is not willing to see in my machine. Aru ni boa bin da boy bune, itu thaki ese boa bi Dimapur Chumu itu ada sabi, bisi waktu itu just certificate hanging there, the person not there. Ideal context India condition. So ground ready to sign up now department क्या मैं बोले मुझे they don't have to run corner to corner, they don't have to enforcing this itu nakribi corner lebih iman dupi guru काम ना jadi government पर diploma दूसरा B farm ना होले भी at least diploma institute निस्ना एक था state के आने से बोले every year 200 100 200 pass out कोई से बोले within 2 years diploma course 2 years से तो 2 years ते 200 to 300 within 4-5 years they pharmacy से बोलता हो जाओ diploma करेंगे ताई खान निजे ही बिसारे के ना जाए आए जाओ pharmacy दे we don't have to go looking for them they themselves will come और pharmacy दे occupy करो तो इधर का situation ना हाँ तो itu एक तो fully implement करें we are a bit nature था सी मना state का condition तो government भी तरह weakness तो जाने वाला के खाली pharmacy के blame करेगा और public खान तो ना जाने pharmacy खान सब बंद कर दे itu kan itu kam nahi na jana ase boisi tu boisi bi kun te at the end of the kun suffer karo public is suffer karo amala district e dia ko college na there are 8 health center community health center ajikali health and welfare center boy 18 district ase 18 sub centers tade bi they are supposed to be pharmacy se thaki bora we're not condemning that GNM, Kurigina, Takahan, they are not qualified. They are qualified in their field, but they are not supposed to handle the medicine as per the Act. The medicine dispense group only pharmacy here, guys. So it nurse can be from like BSc nursing, MSc nursing, Takan. I can qualified as the honey. Only they by the Act, they don't allow. They didn't allow to handle the medicine. It was so it took the IC to strictly follow protocol. So they do policy. It took 20-30 years experience with medicine deal with the Takaman. Just shut down privy with an privy. It took to take no. Believe Sabi, analyze privy, authenticate privy, para manukidu, ekta situation, ekta condition. They are nigana run the privy. So in the hope until such time that among the state. Itu pharmacist ready bagina institute adina itu ready no matok tu itu ek to fully implement no prile bahala si ekta bridge bangawo hote to alternative age bisare to age bridge bangai dele kina gari jabo alternative route age bisare bina to alternative to rakhi kina itu bridge bangai na ten manu bi lobo to itu nisna amhan itu fully implement group ko itu age ekta alternative bisare bina koi dibo to manu ready as to itu to garne ko ase public handi itu jani
kumbal laga PSC khandi government appointees ase only general public khani buhi ase takan to appointment to ekta alak bahadu mano alak iniga laga bi mohalla evidence ase mohan lagode na government kitia itu department itu lagi se bole mohan itu kan sob ready ase ami kan takan logode ki bishi hudise ami kan department logode ki niga bole bal hobo leka leki ami kan logode bishi ase de itu khando department ke dise department ke itu khambi answer mohan ke dibi itu khando mohan itu khan lage department bara du ta la phale bari information dia se ta khan dia laga aru kwala do ala ko jesi newspaper de boje more than 300-400 unemployed pharmacies ase 300 bi punche no according to department issue to ami khan du ko de jabu te du ta khan action aibo ki ba ki bi ligi ne public ke pakala kori dibo itu laga na hoy to ite to bara agi de coordination na bara puri ke ne ami kan step to forward group le laga time hoise itu bara ami kan aji ite thagya to agi de kose ami kan to department laga against nai de ami habi group le ase olibi kini ka bisalu bo rasta ami kan gibi de kabi aru ami kan gibi mundo kuribi to ale ami kan de department ra mang ne expenditure bear kuribi kwa na hoy do rasta kan ami kan ge de kabi to ami kan bi bisalu bo purbo do Olivia Guanis United doing Goje, Tommy Hoko de Jabo, Imam family to put a Jabo, in your concern Tajabra Aji, Amikani de Hishdi.
Moyana, although a question the previous question, then we answer the woman that not. We are not asking for a specific period of time, but we are asking for a reasonable extension of time. When can reasonable do Gushibalido? When we are all stakeholders. There. When that is not the solution. Public suffer war. To when reasonable solution when opinion we are all stakeholders. Pharmacy community, department, medical experts. We have medical experts in the field of medicine in Nagaland also. If necessary, invite from outside. In our Guana, let's sit together and look at the ground reality. Now, what is the reality in our state? It is in our government, come up with a policy. Policy anyway. 5 years after when still iman kiba breedable, in our breedable, when it is solution and in our brain, the public will not suffer. Transition will be smooth. Our state will also move ahead. It was a day. Ito no issue wala do solution no ito. Of course, we'll lose our business. That is also one thing. Let's leave it. Only public to when made dimabor kandi thagyano na man seriously do na how you live. Only mo itia figures ko nuwa dia din nisna sabi do. Meluri district ki choita pharmacy thagisi ekta bi pharmacist nai, so all the 6 pharmacies will be closed down. On top of that, public health units TV 1, 2, 3, 4, 5, 6 choita dito 9. Our sub village dito public health units bi 9. तो उसी मेलोरी गन तो ले माथा बिगा से चल करे हायो रे फेक्टे तवाई इनमले जाबो फेक्टे भी फार्मेसी बचो ना बचो की जन तो चल ना इना नोकरिबो ना पब्लिक भी सफर नोकरिबो इना ना solution permanent solution एकटा बिसार बोली तो I think it's up to the department and that will be our reasonable period of time. The solution that we come up that they come up with, the solution, the road map that the department comes up with will be the reasonable period of time for us.
So, the health minister has denied your appointment. Also, your organization is yet to meet with the chief secretary, signifying that you're not getting an appointment yet. What if this continues and then your pharmacy is forced to close? Will you just close down, or will you take to the streets or something? What plans do you have?
No, see, as of now, we don't have any such plan of action. We are not going to come out on the streets. We are not going to resort to some violent actions. We are not going to resort to any violent actions. But we want to knock sense into the heads of the department officials as well as the government to face reality. To face reality. Because Sadi Bhagwan is enough. Invention is the mother of needs. According to our needs, we invent. We innovate. So, tell na, a certain period of time, in the meantime, a workable solution, work out criminally. It will appeal president. We still now we are only appealing.
Ito yung ito ang puno kulibo ito. Ito yung na kami kan kini ko kulibo. Kami ang puti jabo. Ito bi udia se kami kan so bi akar burase go ito department do kami kan laka plibi ini gini ekta kiba understanding da higina kurili to biji balo bola. Nakali di further course da kami ki kulibo na se ne. Olibi ini kapi hoji bole do ini kotha bra action ke respect kuri kene action ini ga kuri thagiala itu bi hona bole to opanai do na ini gala situation bi ai jamu ano di na itu bra mi khan department ko di bi ko bole mon thake do ini ga na hoy kene ami khan ke check kura ni jina ta han bi government employee kuri kene rang gura khan check kuri na tan employee kuri kene money subsidy gura khan rakhi na for example memory employee pharmacies bole bi tai pharmacies bahana do दूसरा मैंने just merely graduate बने बोला तो अमेरिकन इटू kan la figure job district अमेरिकन बिचारे ऐसे कि मन ऐसे कि निका से fake ऐसे ना ना office पर paper de issue करा तो होसा ऐसे ना अमेरिकन टीवी भी सासे बोले भी तो कमी तभी ठीक ना तो अमेरिकन के कोई target तो खाली कोई बताऊं दिमापुर चुमू इनिका खाने target पूरे what is to the rest of the district तो किमान suffer करे से अमेरिकन तो हम सब साइए ने इटू आगे तो कोई नहीं ना ahigina jama kurigine inika ole du na hobo jana se Nagaland organization bisi ho jaise ma bi tu alsi lagi kintu itu compel ami kan ke compel pura ami kan inika higine ajia higine ami kan rights tu inika pasdi.
Can you allege that the department is issuing license without asking for certificate? So you mean to say that the department has been randomly issuing pharmacy license to the licensees?
No, we'll leave that answer to the department.
Tagane issue issue to tangi tipo.
Ito license as a camera cover for well and good. Well and good.
How much do they charge for registration? May we also know that amount, please?
It varies from person to person.
Ito is not
Uniform.
Not uniform.
Week one is na.
So there is a backdoor appointment kind of thing issuing license also. You admit that.
No, it's something like this. Something like
You have
this.
the connections to get the license. Even if you are not a certified pharmacist.
Whether the department resorted to corrupt practice or not, we are not alleging anything. but we'll just leave the answer to the department to answer. But this is the fact. We itu license apply kura ende application ekta likhise China department ke dise department bara odo din dia ide gise chaise jado ile itu license hena ho gise yade SR Chowdhury ase time bara itu qualified person time bara designate korisile time bara department yes dise
itu apni khan application they mention that.
No. They are only now when it is there. We are supposed to, take the certificate as well as who knows, even the person concerned. Only department from when ye udin India vise jaise SR Chowdhury la nam do hali dise registration number 334 hali na dise. Department ra idu dise do.
So why didn't you complain in the first place when you know that it's faulty?
No, that was the system. Okay, and like I said, being layman, okay, being layman, we are not familiar with all these legal terms. Yeah, all these legal intricacies. Let's say. So we got the license. We came back happily. We opened our shop. We didn't know that. But I even haven't seen who SR Chowdhury is. Not even in my dream. Only now I'm coming to realize that, I have to produce that certificate also.
See, that may not be the same case in every person. Itu alam nak nama after group. Amala case tu alam case tu alam. Boleh ni, aman ke itu ani bi kuatu criteria ekta fulfill kuru karne ana hai. Like among driving license mana lebih ki mana lebih residential permanent residential cert lebih no NOC lebih points na. So those are the record documents you bring going out to amount to some question. So lebih at that time, jadi takkan pra without pharmacies cannot be run. Going out clear cut from day one. Takkan pra koi disi boleh. Among kan we could have go for another option. So pharmacy run boleh chance na moi. Going out itu din pra moi so professionally choose ko pora. Lebih itulah tu aman ki phone man to just to fulfill the criteria ekta ani biko se ani se fulfill hoise aman ki authorize dise pharmacy khuli bole amala namte ase pharmacy bi to thik ase khuli dakha dinte 20 years upor run gura pichite itu 20 years ko to ni no renew gura every 4 years renew guri gina ahi ase to renew gura dinte ko bi na next year to apni ke bon hobe dai ko na precaution no pai to guri na last day kun ba to 30 years run gura be 25 years run gura pichite apni ta qualified no hai bo to ki ase.
Latest renewal to, it was a day. Last year, January the latest. Itu भी department में renew करे लगा से. अभी का भरा ना हुई. अब itu भी ऐसे दे. Itu department itu का ताकन issue करे से. ओए first पहले तो ताकन महान ना जाने लेबी ताकन तो जाने ऐसे तो. तो इन्हीं का उसे बोले तो renew करा था हम दिन तो इन्हीं का ना हो बोले बोले तो होशी तो. Last year तभी ना itu भी issue करे से तो इधर भी ना. तो issue kurasi aru phone kurasi to ami kami national hoise itu kan answer to department he answer kurile ba ami kami national itu kan to
apni hange itu bong group ko la notification de kita disi ko
2021
Taika 2020 de time to time la kiba to change kurile time I stands to change kurile Kunuwa dem di kwese then 2020 bar disi when stick kwese then. Kunuwa dem di kwese 2020 de newspaper de through newspaper then publish kuri se but because of COVID we then udula issue to less second grenade par rakhi rakhi se. Ina kwese. Polibi one lo de personally ina una ahia do le 2021 September bar.
तो 21 September de dile apni kan itia to koki ko thai
Na idua man me pari ada kan do appoint gure ase do.
manu hi na thaya mara ko to brani bona kiman pase man to burase na bole bi manu hi na thaya brani kambi itu the answer dikini ka ko
logic to ki ase pharmacies to 9 no pharmacies cannot be run without pharmacies to ase only they are still issuing the license till 2024 aru dias to ifale am handi na paina ase poila la issue video anbi debi na paina ase aru kile notun dias तो itu in proportionate আছে তো itu balance আইনা দিব লাগে তো pharmacist লাগে কইলে pharmacist কিমান আছে নাগালেণ্ডে তাখানা রিপোর্ট আছে registered pharmacy because they didn't allow from outside state out of the state, so it is very much in their record, so they should know how many pharmacies are vacant না কিমান pharmacist ফিল কৰিব পাৰিব itu জানি নাই তাহান বি লাইসেন্স বি দিব লাগে তো only be number of license drugs license issue কৰা তুলে তো ये फिगर তে 1157 আছে only be actual লুকাইনা বৰ্ডে পয়া বেছি আছে দেবি কোৱা হিচাপে তো 3-4,000 লাইসেন্স বি ইস্যু কৰা আছে নেকি তোমাৰ হিচাপে তো দিয়া মন তো ক'ব নোৱাৰে এদিকে আছে only be run brought 1,000 plus run কৰা আছে তো ইটো টিভি আমান we are running sort of this pharmacies qualified pharmacies
Itu kan lakan actual number kan jani mo nimide ami kan kiman issue kuri dije. Itu kan actual number jani mo nimide on the 1st of May this year. Ami kan itu letter kami department ke dije. Itu kan answer mo hangi dibi. Na. Itu kami dianai do, itebi dianai do itebi mo hangi. Apni kami sabo ko itu mo hangi asa de. Ami kan itu kan so pa ai na mo lo de se.
RTI আছে এগুলো?
RTI na ini
we have
application.
put around 13-11 questions they have answers so for only 2 questions
So when did you put out this RTI?
1st May.
Government has resorted to many, well, what term you call it or what term you call it, let them use the term, but they have resorted, they have stepped out of the boundary. But we are not accusing the department, okay? We are not trying to find fault with the department, we are not accusing them because that is not the solution. That is not the solution. But ANBA is of the view that only the general public will suffer. So we appeal to the department to come up with some sort of solution so that at least the transition to a better Nagaland will be smooth.